Good day, everyone. I am Dr. Mithun, pediatric orthopedic consultant, Germanten Hospital, Attapur, Hyderabad. Today, I want to briefly explain about the normal physiological growth changes and some red flag signs that may look like a normal growth, but patient might be having some deformities or some metabolic changes inside the bone. The issues can be broadly categorized into the term deformity. Some deformities are certain at some age group, but some are normal. For example, if a newborn child is born, the kid might be having a deformity in the foot, which is most commonly known as club foot, or in medical terms, it is referred to as congenital talipes equinox varus. In this condition, the foot is facing downwards and inwards, which resembles a golf club. So the name is club foot. Most of the club foot is diagnosed antenatally through ultrasound or some are missed. These can be diagnosed as soon as the child is born with a deformity in the foot. Our treatment protocol for this club foot is designed by Dr. Ponsetti, who just gave a beautiful thing for treating the CTEV conservatively. So it involves two phases. One is the correction phase, where the deformity corrects gradually through the application of above knee cast every week. And the second one is the maintenance phase. Once the correction is done, it has to be maintained in a brace. So that duration takes up to 3 to 4 years of child. So with this treatment, your child can get a normal looking foot and a fully functional feet. So till now we have seen the deformities that happens before 1 year of age. Now we can see the deformities that happens in the toddler age group, that is 1 to 5 years of age. In this age group, most of the parents are worried about their children's leg that looks somewhat deformed. So before going into the abnormality, we should know the normal growth patterns and normal change that occurs in the lower limb. So when a newborn is born, the knees are naturally bowed. That means the knee is totally away from each other. So this kind of deformity is normal up till 2 years of age, and once the two baby attains the 2 or 3 years of age, that knees comes closer and the feet moves away. So this is called the physiological genu valgum. So this genu valgum mostly peaks at around 4 years of age, and slowly the legs become straight at the end of 7 years of age. So when to seek the evaluation of a pediatric orthopedician? So that's a good question if you see. So if there is a more deformity or more of the bowing in the knee joint before 2 years of age, or if the bowing persists beyond 2 years of age, or if the genu valgum, which I referred as knees moving towards each other and foot going outwards, if that condition is more or if it persists beyond 7 years of age, then you need to seek a pediatric orthopedician opinion. So if these kind of deformities are present, mostly your child is likely to have a metabolic bone disease underlying. So most of this condition gets cured with a medical treatment. Some may not resolve on its own. Those kind of condition needs a surgical intervention in the name of growth modulation to maintain the alignment of the bone. So to conclude, early diagnosis and timely treatment is a key event for success to make a child with a good bone health and development. Thank you.